Vertical bitewings. Vertical bitewings are films that show both upper and lower teeth in one image, but the view extends further down the root. In general, vertical bitewings give an excellent image of the bone and surrounding structures. We would normally take 4 posterior vertical bitewings and 2 premolars and 2 molars. Before the procedure begins, follow step 1 through 3 for all bitewing images. In this video, we will use the regular bitewing tabs. These tabs are typically attached to the center and the flat side of the receptor. For the vertical bitewings, the longer portion of the receptor is placed in an up and down direction. The receptor should be inserted in an up and down direction into the patient's mouth between the tongue and the teeth. We will begin with a premolar image by centering the receptor on the mandibular second premolar, making sure that the front edge of the receptor is aligned with the midline of the mandibular canine, because we want to include on our image the distal aspect of the canine. Remember, a vertical angulation of positive 10 degrees or plus 10 degrees is recommended for all bitewing images. Once the receptor has been positioned, you want to set the tube head at plus 10 degrees by moving it downward to number 10. For the purpose of exposing on dexter, line the tube head with the eyebrows and slightly under the zygomatic arch. Rotate the tube head, making sure it is parallel to the curvature of the zygomatic arch, and that the beam can go straight through the contact areas of the teeth by visualizing the central beam. Make sure the tube head is positioned evenly over maxillary and mandibular arch. Also, keep in mind that the tube head should be positioned far enough forward to cover both maxillary and mandibular canines. Stand directly behind the tube head and make sure that the receptor is completely covered by the tube head in order to avoid cone cuts. Lastly, expose the receptor. As a result, the contact areas of the exposed image appear opened and can be used for evidence of caries, an excellent source to visualize the bone and surrounding structures. Now we will demonstrate the molar exposure. For the molar exposure, the receptor is placed further posterior, centered over the present molars, while making sure the front edge of the receptor is aligned with the midline of the mandibular second premolar, because we want to see the distal aspect of the mandibular second premolar on this image. Once the receptor has been positioned, set the tube head at plus 10 degrees or positive 10 degrees. When taking these radiographs on a dexter, use the sideburns, which are located right under the zygomatic arch, and rotate the tube head slightly just to follow the curvature of the zygomatic arch. Now, keep in mind that you will not need to rotate the tube head as much for the molar exposure, because the teeth are mostly in a straighter line in the posterior. Ensure that the central beam can go straight to the contact areas of the teeth by pulling back the tube head and visualizing the central beam going through the contacts of the teeth. Also, keep in mind that the tube head should be positioned as such and cover the mesial of the third molars if present, as well as the distal aspect of the second premolars. Again, make sure the receptor is covered by the tube head in order to avoid cone cuts. Lastly, expose the receptor.